if you have a liver problem, you had to come to Rotterdam. We work together with surgeons, with radiologists, with pathologists, virologists, and together we try to take care of a patient with a liver disease. And you need all these specialties for these patients. And I think that's unique in the world, that we are a unit with all these specialists working together. We have one goal: to make a liver better or get a better liver, and that we do together.
We have one portal, and that all patients from different surroundings, different other specialties, they are guarded by our hepatologists. We have a lot of medical expertise. For instance, surgeons, hepatologists of course, then medical oncologists, interventional radiologists, radiotherapists, and all those specialists together, they make a tailor-made decision, individualized for this patient. And I think that's the good thing about our multidisciplinary approach. If the patient is on the ward, we walk the rounds together. And if there are problems, we see them together and we can solve them together. I think that's in the best of interest for our patients. I think from a patient perspective, we want to know how well is your survival after liver transplantation. We do well above average internationally. We have a patient survival over 90% in the first year and over 80% after 3 years. Besides that, I think what's more important for patients that don't get transplanted right away but are treated with another modality first, they are treated by the same team. So if their liver disease deteriorates, it's the same team of specialists taking care of either surgery or other ablative therapies, progressing maybe into transplantation. I think that's the real gain of this liver unit.
I think the liver unit at Erasmus is a very dynamic place because we have a very strong interaction, a very strong collaboration between the clinic and the laboratory. Because we have a very close interaction with the clinic, we perform clinical trials, we are able to initiate investigator-initiated studies as well as very basic studies. So because of our embedding in the clinic, we are able to perform a wide range of different techniques.
In the Erasmus Medical Center, I think we are very fortunate that we are more or less ahead in viral hepatitis. For that, we are a tertiary referral center. That means that patients from all over the country come to us for treatment or advice. And that's mainly because we have all kinds of treatments available, the regular ones as well as the new ones. We collaborate together with hospitals within the Netherlands, but mainly also with centers outside. We have performed many studies on new medication in viral hepatitis from all phases, so phase 1, phase 2, phase 3. And by doing that, I think that we can offer the best care in viral hepatitis for the general patient.
I'm responsible for the training program in the Netherlands in hepatology, and we attract junior specialists from all over the country and also a bit from Belgium to stay with us and stay with us for 4 or 8 months to work in hepatology, get acquainted with the diseases and also the skills that you need. In addition to that, we are having a European accreditation for training. The most important opportunity for both us as well as ALSLD is to interest young people, dynamic people, talented people in hepatology and make the hepatologists of the future. We have all the possibilities, the opportunities to do that. And now it's the match between people who want to do that and grab these opportunities and the facilities that we have to offer them. And there are real chances there.
The Netherlands is fortunate to have a strong PhD school. The trainees can, prior to their trainee, actually go into a PhD program and spend 3 to 4 years on doing pure research. At the liver unit at the moment we have 17 PhD students, either working in the clinic or in the lab. It is important that these young, energetic people, they are supported by their team. Furthermore, what is important is a good collaboration throughout the world.
We're aiming at expanding to become bigger and bigger and to continue what we are doing, investing in translational research and investing in basic research and continuing with our work on clinical research with investigator-initiated trials. We have to make new projects and we have short lines of communication. That's what I call its dynamic state. It's every day changing and moving to the future. So it's a dynamic department.